find disc. Okay.
No,
Well, we use needle, right?
Very sharp.
And control by seal.
This is an artificial blade. Use the needle.
Dura is
Check control by seal.
very strong
But anyway, in the
structure.
middle, right? In the middle.
Dura is thick.
And we assume it's disc.
High.
So we can start just cutting, right?
Make a cut. When you make abdominal surgery, you never cut intestine or something like that. Just in your life.
Yeah.
뉴스 런죠.
Professor, you use
Microscope. Cervical disc. Microscope. But
After we see the disc, we
I can make without any problem without microscope because my visual acuity is very good.
have carousel. You don't have carousel here.
What's the purpose you use microscope?
Better visualization and for my assistant doctors and nurses, they can see simultaneously.
On the
TV and same vision.
You don't have carousel.
no carousel.
No carousel. Just listen. Okay. I can keep like this. No problem. Okay. I can hold it with my hand. You are very,
See, it's a carousel, right?
you are very courageous, brave man. Only the brave man can make surgery.
Yes, that. This one, right?
Usually, always I'm using maple frame or hello frame.
Behind and you
But you can make it with ordinary transparent wooden operating.
And we also
Pillow
use to
back of my neck.
yes.
Hyperextend.
Clean it.
for disposal.
Yep. You use very small.
So we use
Make the head stable. You can make
system that you have because of the you're making the differentiation putting your sandbag or cervix sometimes
How do we know that? This is
roll
This is cranial.
roll the gowns
So
or
this
something.
is
And use
this is called yeah. So this is a direction.
wooden board like this. Wooden board. So the patient's body weight compress.
So remove. This is trial.
You can X-ray can be easily see without disruption. But if you use sandbag, it is not so good.
case has because you put use a hammer.
Yeah.
Proper position. Oh, the size of that.
You can measure with
Very important. If you're happy.
and remember, always disc is not in the center. Disc is always in the posterolateral part. The midline disc has no symptom, so we need not operate. Always we have disc hernia at the posterolateral foraminal level.
So we are happy with this bone, we remove it and change to this bone. The bone graft inside.
Yes, that's
For
right.
ACDF, you will have to be careful few things. Starting from your, say, carotid artery, then when you are entry to this spine, you should be very, very careful not very much lateral because here is the particular artery. So you should be very, very careful. And posteriorly you will not damage. Sometimes we remove posterior longitudinal ligament, but you should be very, very careful after that because immediately after your posterior longitudinal ligament there is dura. And in cervical region, very small amount of your abdominal fat. You will get lot of fat in your as from thoracic, lumbar, lower thoracic, upper lumbar, lower abdominal fat. But here is very minimal abdominal fat. Okay? So when you are going from front to behind, so you should be very, very careful. Laterally, you will go that path. Sometimes we go up to this uncomfortable, this uncomfortable elevated part, this upper part and lower part, this sort of joint formation, uncomfortable joint. As you see, this is posterolateral. This remains exactly this position. So you should be very careful to remove this because sometimes there's some remains some epidural vessel. You can induce the epidural vessel. So in the centrally, if you go more posterior, then you can damage dura, and in the laterally you can damage dura as well as your nasal and epidural vessel. Sometimes the huge bleeding may come. So you should be very, very careful when you are near to this posterior longitudinal ligament and dura. Okay.
So when we remove this around here, we use current.
So as you were telling, how you can you can use by your own eyes, you can use your loop, or you have the microscope. If you have the operating microscope, you can say I am doing a lot of this, I don't have any operating microscope. In our side, I don't have look, going to my direct eye vision. So this is your assessment. You will understand that yes, when you are removing all the body part and posteriorly you are going, first of all you are removing this is your the body, but initially we remove your disc material. So when totally you are removing the disc, you can see your articular cartilage. So from anterior you can go behind and you can see the end of your articular cartilage. So you can understand, yes, this is my posterior limit. From anterior to this is my posterior limit, so I should be very, very careful. So when you go at the level of posterior edge of your articular cartilage, you can easily see and you can feel sometimes your posterior longitudinal, provided yes, if it is not traumatic, then this posterior longitudinal is intact. So you can feel, even especially by seeing the curate, small curate, you can see, yes, you can feel, and then you will have to make your incision over this posterior longitudinal, just incision, but not certain times, otherwise you will damage it. So you will understand. I use 15 side. Somebody likes to use the 11 side, but 11 is very pointed. Yeah, discectomy knife. I use a 15 side, but I'm very 15. Yeah. And before that, what I do, I use your Gaspar retract. You are putting the Gaspar screw here and there, then you are distracting. When you are distracting, you are getting stressing, and then you can understand the posterior longitudinal ligament. You can feel, you can see. Then when you are giving the distraction, this distraction well visualized in your posterior longitudinal ligament. Okay, then you will make a stab incision. Then by using your cut or kerosene, this is the piece. You will cut a small piece. Then you will see, and there is a dural hook. Dural hook. You can feel. So whether the dura is free, and also you can feel the nerve. We have to do You can feel this is the dura, and you can feel the dura small. You can feel there is no pressure over the. Say this is left side, no pressure in the left side, and you can feel the right side, but not that much. Otherwise you can injure vertebral artery. So just very gently you can feel, yes, there is no pressure, there is no discomfort, nothing is there. So you have removed successfully all the redundant posterior ligament, and if it is well visualized, even you can see dural pulsation. Dural pulsation. So when you will see by your own eyes the dural pulsation, you are sure that it is totally decompressed. No pressure over the spinal cord, no pressure over the root. So then you will be satisfied that you are
One more point that I remove those posterior ligament.
I got the posterior longitudinal ligament. Depends on what sort of surgery. Say if it is say disc posterior the left or right, then definitely you will have to cut. But sometimes when it is well visualized, you can see either microscope, lobe, or your own direct eye is about to let disc, and if you put that disc on it, removing the disc very fine, and already there is no pressure, you can feel by your hand. Sometimes somebody there is a two group of things. One group thinks that's okay. So one side you have used this, you have removed. So hopefully there is no pressure over the keyboard or that side of the room. So no need to cut posterior longitudinal. It's one group. And the other group thinks that this small piece may be redundant here. So there may have some redundant disc. So why not take chance? Better to cut posterior longitudinal and you see with the board and rope. Because second surgery is not expected or accepted. Either by some or by even patient. So better go for I don't take any risk. I can't posterior longitudinal ligament totally, and I want to see and when I see the progress, then I'm happy. So everybody should be there.
Fusion.
Then so when you are retracting and then you remove the either distracting
1 hour later.
then you will measure the size as you was telling me how will just this your estimation, not too very straight, not too very loose, not too straight, not too this sort of position you will measure. There is a measuring instrument. Sometimes even what I do in our perspective, so we cut a small saline set, then you take normal cutting area, so your own size, accordingly we take the then after giving the iliac crest, you will have to be very careful to do things when you will take the iliac crest.